Welcome to the International Association for Adolescent Health Pioneers Project. In this series, we have interviewed a range of experts from around the world who have led the way in promoting adolescent health in their countries, regions, or internationally. We wanted to listen to their stories and share their experiences so that these might be applied elsewhere. The members of the IAAH Education Committee were particularly interested in how these pioneers influence the education and training of healthcare professionals in adolescent health. In the following interview, Dr. Melissa Kang is speaking with Dr. Murray Williams and Dr. David Bennett about their experiences in Australia.
So, hello everybody, my name is Melissa Kang and I am currently the Vice President Oceania on the Council of the International Association for Adolescent Health. I'm speaking to you today in my capacity as a member of the Education Committee of IAAH, and I'm absolutely thrilled to be joined this morning, it's morning in Sydney, Australia and Canberra, by two eminent adolescent physicians who really were the founding fathers of adolescent medicine in our country here in Australia. This interview is part of a series of interviews from our colleagues around the world where we are talking to other founding people in their regions or countries who have really led the development of the field of adolescent medicine and health. So I'm going to begin by telling you a little bit about Murray Williams and David Bennett. Dr. Murray Williams graduated from the University of Queensland, Australia in 1951, and 2 years later became the resident doctor at Geelong Grammar School in Victoria. Murray then went on to become one of the early trainees at the adolescent unit of the Children's Hospital in Boston, Massachusetts, which was founded by J. Roswell Gallagher. Murray returned to Australia in 1958, determined to pursue adolescent medicine. He set up the Student Health Service at the Canberra College of Advanced Education, which is now the University of Canberra, as well as at the University of Queensland. Murray went on to establish and lead both the Australian Association for Adolescent Health in 1978, but also the International Association for Adolescent Health in 1987. Murray was honoured with an Officer of the Order of Australia in 1991 for service to medicine and adolescent health. So thank you for joining us, Murray. Professor David Bennett is an adolescent health physician who graduated from the University of Queensland in 1968. He completed internal medicine training at the Princess Alexandra Hospital in Brisbane and an adolescent medicine fellowship at the Children's Hospital in Birmingham, Alabama. Returning to Australia, he established Australia's first adolescent medical unit at the Children's Hospital at Camperdown in Sydney in 1977. David served on many policy and advisory committees at state and federal levels and headed the New South Wales Centre for the Advancement of Adolescent Health from 1998 to 2013. David was involved in a wide-ranging efforts to improve the health and well-being of young people through collaborative research, professional education, networking and advocacy. David was president of the International Association for Adolescent Health from 1989 to 1994. And David was also honoured with an Officer of the Order of Australia in 1995 for service to medicine, particularly in the field of adolescent health and medical care. I have to say, I feel completely overwhelmed to be in the company of such great men and such incredible founding fathers of adolescent medicine in this country. So thank you both so much for giving up your time to join us. I'm going to be asking you a series of questions. Please feel free to sidetrack if you wish, but really the purpose of these interviews is both to inspire listeners and members of IAAH, and in fact anybody from around the world interested in working with young people. But it's also perhaps to seek your wisdom to get some practical ideas about how other people around the world might consider ways forward to try and build and develop the field of adolescent medicine and health in their own regions. But I'd like to start by asking each of you, first you, Murray, and then David, about if you could tell us a little bit about those formative years, which we all know to be adolescence, and what it was about perhaps your adolescence that led you to want to study medicine, and then certainly then to move into the area of adolescent health. Murray, would you like to tell us a bit about that part of your life?
Well, yes, it was formative indeed. And I was sent off to boarding school from country Queensland at the age of 11, spent the next 7 years there and 6 more years in a residential college. So I was more or less committed to institutions for all of that time. And I realised in retrospect that it did make me think a lot about what you just said and why I went the direction that I did. I had a pleasant enough time at school and I had no bad experiences, but it was a place without empathy or warmth. So that, anything good that happened, you have to engineer for yourself, really. But, I had friends and everything worked along quite well. But only one teacher in that whole time ever treated me as a human being. We had excellent teachers, but they're all very professional and good at their jobs. And that was it, there was no interaction otherwise. So at the end of school, I had already sort of made some mental notes, which were sort of half underlined, I suppose. But by the time I'd finished my medical course after the next 6 years in the university college, I'd begun to see that there was a need here, same with the young men in the college where I lived, who would get sick or break their ankle or do all sorts of things. And there was no one to look after them. There was no student health service. They tottered off to the hospital or didn't get looked after at all. So I began to think this isn't quite good enough, really. There must be a better way of doing it because so much is going on. So without sort of wanting to enlarge on it, that's where it started for me. And by the end of that, I was looking for a way of maybe pursuing this. And by great good luck, I spoke to James Darling at Geelong Grammar School, incidentally, who I was at a conference at his school. And he invited me to join his staff, which is quite astonishing. So I went there as a tutor and as also the resident school doctor. So I got a bit of both. And it fully underscored what I've just been saying to you. There was certainly plenty of room and very positive room for interaction with young people in terms of their health, not just writing them a prescription. So that's what I think it's all about, really. It was a sort of interaction that I learned about. And then I wanted to learn something about it. And that was when I had the further good luck to discover there was somewhere I could do it in America.
Thank you so much. And you've just so beautifully described that, I think, intersection or perhaps the environment in which adolescents live and spend most of their life in school. And so having that initial job as both a tutor in a school and a physician, in fact, was such a lovely, I imagine, way to begin your practice as a doctor in adolescent health that you then carried through.
It was quite remarkable, yes.
Yeah. Thank you. Thanks, Murray. Now, David, tell us about what led you to adolescent medicine and whether it linked to your formative years as an adolescent as well.
It's an interesting question because I had a really nice childhood, a really loving family. I almost took a musical path because that was something introduced into my life quite early on. I was a sort of a nerdy, bespectacled, serious-minded sort of kid. When it came to starting a medical career, at high school, first of all, I didn't fit in particularly well. It was a very sports-oriented school. I was more interested in literature and debating and music, of course, as well. But I think what steered me towards adolescent health after studying to be a physician, and that was 5 years of hospital, sort of slugging away to get a basic training in medicine. In fact, the subjects I did best at was in first year, botany and the history of the development of Western civilization. So I guess I was a person who might have gone in an arts direction with music, but medicine seemed like a really interesting and worthwhile thing to do. And what steered me to adolescent medicine was, in fact, conversations with Murray. And I think we'll come to that in the next question. But I was always interested in young people, even as a young person, their struggles and passions and interests.
Lovely. Thanks so much, David. Well, I might in fact ask you the next question because it is, how did you both meet? So perhaps, David, you could tell us from your perspective.
Well, I'm just thinking you're now interviewing me. I'm pushing 80. Murray's pushing 100, if I could say that, Murray. You're not offended by that. We've been speaking to each other since I was a an apprehensive medical student in 1963, my very first year of medicine. Murray had established, by invitation, the Student Health Service at the University of Queensland, and I found myself not only consulting, but getting to know a doctor who seemed interested in me as a person. So the origins of my interest was really knowing and understanding that Murray had an unusual background in terms of his training in the United States. And I think we talked about that. So the intervening years of my postgraduate training as a physician, at the end of that time, I wrote down all the organ systems of the body and thought, well, there's nothing there that particularly jumps out at me. So I went back and had another conversation with Murray about how he got into adolescent medicine and found that that was of intense interest to me.
Well, that's wonderful. Thanks. Now, Murray, is that your recollection as well? How would you describe the way you met David?
Well, absolutely, yes. He was an enthusiastic, a very junior medical student, but good at talking, and I love talking to people. So that was really how it happened, that we, on more than one occasion, as you can gather, exchanged conversations at great length sometimes.
Thank you. So look, I'd really now like to turn the interview to pick your brains, really, for you to ask you to share your wisdom, but also some of your practical experiences in the work you did in those early years, establishing adolescent medicine and adolescent health as a specialty in the Australian healthcare system. I'll start with you, Murray, but I'm very happy for you to talk to one another, or to check with one another if that was your experience as well. But the first question is, could you describe how you actually went about establishing adolescent health as a new specialty in medicine here in Australia, or whether it happened within an existing discipline such as paediatrics or general practice, or what did you actually do to make it happen?
Yes, I don't know that I set out with a goal. I just set out to do my thing. I was fortunate in being offered a job to start a student health service, and I was familiar with student health services because I had experienced the one at Harvard, where I was studying at the Children's Hospital next door. So I knew how to run a medical practice because my father was a doctor, and I worked with him and for him often over time. So in a little tiny corner of space, which didn't get much bigger over all the time that I was there, we set up a consulting room and a waiting room and so on. And it grew from there. So I just did the right thing as far as I could see for the students, making something for them which was readily available, free, companionable and cheerful. My staff were instructed never to be nasty to people, or never to be rude, or hold them up in ways, and to do whatever they could to make them feel at home. So I tried to establish an atmosphere which I think is really fairly central to all that we're talking about, which accepts young people as they are, and it's not catering to them at all, but just taking them in as you want to do. And my word for that's availability. An available medical student service, and you'll know I've written some things about that. And it's available. The other kind of thing was to be askable. That's a word which just comes up repeatedly in my vocabulary because it says exactly what I want to say. I'm someone who can ask things, and feel comfortable about it. Because a lot of young people, particularly young men, have a lot of difficulty in expressing things about themselves they feel are private. And we respect that, but there are times when they need to, and you can help by making it a bit easier to ask. So that's really what happened, and it grew from strength to strength very quickly, as David could tell you. We grew ourselves out of our space and spread here next door. They offered us air conditioning once with the effluent air from the toilets, which I discouraged from happening. But it was that kind of hit and miss kind of arrangement which were working in difficult circumstances in Queensland University. But for all of that, we thrived, and I had a very happy team of people. By the time I was finished there, I had a number of consultants. My first consultant was actually the late Barry Nurcombe, who was a psychiatrist and had just finished his training. And I had learned how to use a psychiatrist in this setting in Boston. So he came as our consultant psychiatrist, and he didn't necessarily see the patient so much as talk to us, the student counsellors, and myself and other members of my staff. So it was just a way of doing things, that's all. And we then added various other people as time went by.
Look, you've just described so beautifully and eloquently the qualities that you brought to the service as a doctor and a human, I would say, and also how the institution in which the service was established responded to that by wanting to expand. And I guess it was also driven by demand and perhaps other young people hearing about the service and wanting to come to you. And I think that that's possibly the way a lot of innovative services start is with one person or perhaps one team of people. David, do you want to respond to that and sort of talk about how it then might have grown from there?
I mean, Murray's an inherently modest man.
Yes,
you know, having had that experience in Boston and then spending many years trying to get some traction for the field in Australia, I must say, would not have started on this path without the encouragement and leadership in thinking that Murray showed. But I think most of us are so influenced by the experiences we had during training. So going off to Birmingham, Alabama in the early 70s gave me an opportunity to be immersed and become inspired by the energy and enthusiasm that was evolving in adolescent medicine at the time. And when I turned up in 1974, that was the year in which the first international meeting was held in Helsinki with Oliver Hurkett. And my boss, Bill Daniel, went off to that conference and came back really inspired about the international gathering that happened.
So did I.
You were there as well?
Yeah.
You were there as well, Murray? Okay, so look, I would say that's a very pivotal thing, because subsequently, just in terms of this chronology, another international symposium was held in Washington, DC in 1979. And I went to that meeting back to America and met Manny Shigia from Israel, who had put up his hand to host the meeting in 1983, which Murray and I and John Court from Melbourne and others attended. And the significance of that meeting was that we made a bid and decided that we would host the meeting that established IAAH. Prior to that, coming back to Australia, Murray had a student health service and modelled a type of practice. I had been inspired by different models of healthcare for young people, and with Suzanne Robertson, a paediatrician who trained in Washington, DC with an Australian called Andy Rigg, she and I jointly set up the adolescent unit at the Children's Hospital in Sydney. And we started to develop a model which went just beyond medical care. So the whole notion of multidisciplinary care started really because of the things that were happening in the United States. So being to America was an experience that both Murray and I shared that got us thinking about ways to do things in Australia.
I'm going to come back to ask both of you more about specifically training and education, but just, you know, it's so interesting to me that two people amongst all the graduating doctors in the country could go and have these kind of life-changing, perhaps personal experiences overseas where the field was more developed, but bring something back to your own countries where there was nothing, and you know, really lead the way to where we are today here in Australia. I'm just wondering, between those early years and attending those couple of international conferences and learning from other people from different parts of the world, was it, you know, coming together to form IAAH? Was it more to do with the Australian Association for Adolescent Health that really got things going nationally? Yes. What would you say?
It was. I'll answer that first, Murray, because you sat at the side of everything that I was doing, and we were in constant communication and collaboration. Murray had contacts in Canberra and sought funding for a meeting that brought 15 doctors to Sydney, and we met in December 1978. Is that correct? Yes. I think that's right. The unit had started a year before. And I can remember that meeting very well because we had a conversation and we had presentations, and two young people were invited to come and speak to this group of doctors from around the country. John Court from Melbourne, I remember particularly. And they said that one of the problems they see is that healthcare professionals are rigid and and not cold, not warm.
Yeah.
And they asked that we think about how to change that in Australia. Now, Murray had got money from the Federal Department of Health to fund this meeting. So that seminar is absolutely crucial. And at that meeting, it was decided that we would create a non-government organisation to advocate for improving the health of youth in Australia. And it's significant that we chose the word health in the name rather than medicine, but it was modelled on the Society for Adolescent Medicine, which had been created a decade earlier in 1968. So that's I think that organisation became the national encouraging group, and a lot of very good things happened, including another federally funded conference in Australia in 1981, and then subsequently the one that set up IAAH in 87.
Thanks, David. And it sounds like what you're saying really is that Murray was instrumental in getting that little bit of funding, or however much it was, to bring those 15 doctors together in Canberra. Murray, can you tell us or remember how did you do that? How did you convince the government at the time to fund something like this?
I can't remember which strings I pulled because I didn't have any, but I don't even remember what sort of government was in power at the time, but I suppose that they were interested in sort of, well, broadly social welfare, to put it into words. Yeah. And I just happened to hit the right note, I think, because there was a sudden expansion in the size of the adolescent population post-war. So they were already in middle adolescence by the time we're speaking of, into the 60s, 70s. Yeah. And there was quite burgeoning needs, obvious to anyone who sort of was in touch with the news, and with young people. And the fact that they were more assertive and more obvious, and perhaps more exciting or threatening, depending which way you looked at it. Yeah. So it was good luck, really.
I'm sure it was more than that.
But that's how it happened. And up until then, that was, 18 years after I started at Queensland University in 1960. So it didn't happen overnight. But what had happened in that time, that I'd tried to sort of talk as much as I possibly could by way of publication, and had, I have to say, enormous support from the Medical Journal of Australia, and later on down the line from Australian Family Physician, who accepted without any arguments the sort of things I sent to them, which were a mixed bag of all sorts of things, but there wasn't just articles on adolescents, there were reviews and comments and letters and reports and all sorts of things. I was astonished myself when I got loose amongst my archive recently to find how much stuff was there I'd forgotten about. So I'd been sort of stirring around and sending out the centre of all of this a newsletter to an increasing number of people who seemed to like getting it. So I think that was a key thing that worked through and continued to work for quite a long time after that. So there were people all over Australia. They weren't only doctors, but they were nurses and social workers and school counsellors and teachers and all sorts of people who found an interest there and wanted more. And I enjoyed doing that, and it worked.
I can't underline the importance of that enough. That the newsletters, which went out 3 or 4 times a year under the auspice of the Australian Association for Adolescent Health, reached a lot of people, and Murray constantly edited and updated that. But the money that was given for that initial seminar continued to support IAAH. So that became eventually a national organisation with some clout. And I think that's why IAAH was able to auspice a major international meeting, which had never happened before on that scale, in 1987, which gave rise to the international body.
Well, look, could I sidetrack? I don't know that I had this in the scripted list of questions, but could you both talk a little bit about IAAH? Because I'm here representing the Education Committee of IAAH, and it's been an absolute privilege to have been launched into the international sphere, having been really very, very Australia focused for most of my career. Could you tell us a little bit about that period of time and how IAAH actually came to be formed?
If I might start, but you're now working in IAAH, and I was invited back by Susan Sawyer, our immediate past president in IAAH, to play a role, having been uninvolved for a very long time. And it gave me a chance to reflect on the early years and write some articles about our history, and that's been an absolute pleasure. And it's also been an opportunity to bring some of the pioneering people to the attention of our membership. But really, I think the way in which IAAH came about was because of the connections that were made between people, particularly those who were getting to know people in the United States, but also in Europe as well. But people like Bob Blum and Richard McKenzie, Evelyn Eisenstein in Brazil, and many other people were becoming interested in communicating with each other. And I must give credit to Manny and Roger Tonkin, one of our past presidents in IAAH, for setting up the international chapter of SAM. That was in 1986. And that also presaged the meeting that we had in 87. But SAM co-sponsored that. And WHO was present and affirming of not only the need, but the desirability of bringing together national and regional organisations in one place. So I want to pay tribute to the Society for Adolescent Medicine for its encouragement absolutely all the way through. And that relationship is strong and burgeoning, as you know. And our relationship with WHO was also pivotal. And just on a personal note there, Bob Blum was the first adolescent health physician in the world to go to Geneva and have a sabbatical experience there. That was in 87, 88, so just after our conference. But in 90, I had a sabbatical there as well as the president. I was already just the president of IAAH. And that was a way to foster a relationship with WHO in Geneva. So all those elements had made a contribution. But Murray, as the inaugurator of IAAH, I must just go back to that meeting in 87 because, Murray, we invited a whole lot of people with a view to creating this international body, and you chaired that meeting. 16 people signed a charter, and you became the inaugural chair of a committee, which became an executive for IAAH. I was on that, as was a number of people, including representatives from WHO and SAM. Joe Sanders and Herb Friedman assisted. But it started at a meeting which had enthusiasm building for some years as a result of those individually auspiced conferences previously.
Thanks so much, David. Murray, is there anything you'd like to add about the formation of IAAH and particularly your role in it?
No, it all seems a bit of a blur to me now because it got caught up with some very overwhelming happenings in my own life. But I look backwards from where it is now with the astonishment that I feel when I see your reports online of what's going on around the world. It's mind-blowing to see where it all is now, and to think that it got there from what David's just spoken to you about is amazing. I think David was a good agent here, and particularly in his relationship with WHO, because I was not really in that kind of contact with them at that time, whereas he was and pursued it. And he had, well, very supportive and helpful, that's all I can say. And I think that's perhaps one thing that made it go well, isn't it?
Yeah, well, it's so multifaceted and there are so many components from the sound of it that led to where we are now. And I'd therefore like to segue into the role of education and training, because I think what you've described is, having a clinical service and perhaps a school, something located in schools that are welcoming for adolescents, which are important. You've spoken about the need to advocate with governments for funding, whether that's just opportunistic or whether it's more strategic. I think there are many ways that we can continue to advocate for more funding, more services. What was the role in education and training specifically, or what were each of your roles, if any, that were specifically around education and training of the workforce, the health workforce, so that we could really lift the game and the quality of care that we're trained as health professionals to provide for young people? Murray, were you involved in setting up any education and training?
No, I just did it.
Yeah.
I never got involved with any of the movements of that kind, and bear in mind that this is all multifaceted.
Yeah.
There's so many different ways in which this can be achieved and is being achieved at the moment. I continued to sort of try and educate people when I encountered them, and I was particularly with medical students who I've always worked with quite a lot, and some few of them would sort of take the idea aboard at least, but also through publications and the newsletter and so on. So I was just creating kind of a penumbra behind all of this, which kept on reminding people that there is such a thing. And now, of course, if you look around, many general practitioners in their list of interests say adolescent patients, they go quite specifically. Now, I don't know that they've brought this with them from their medical school, most of which are lacking in that kind of training, or whether it's just that they've picked it up to serendipity, really. I mean, if you're working in practice that you see there are needs, and if you've got the will, you can do it. And then, of course, the other kinds of other colours of things like school clinics or street clinics or drop-ins, or all kind of many different things all around the world, which you're more familiar with than I am. So that I was just sort of creating an awareness, that's all. I didn't have any agenda, so to speak.
I'm sure you're being very modest again, Murray. I know that I teach medical students now and have done for many years in one of my jobs, and it hasn't changed in all these decades, that really it takes sometimes just that one experience, one meeting with somebody from the specialty that changes the course of your medical career. That's certainly true for me. And I think you would have been a profound influence on many medical students, whether they went on to do adolescent medicine, but certainly in the way they approached adolescents as patients.
Well, that's right, yes. I mean, I wouldn't expect them to call themselves specialists even. They're just a good GP who includes a lot of adolescents in their practice.
Yeah.
For instance.
Well, Melissa, Murray's forgotten to mention that he surveyed all the medical schools in Australia and said to them, what are you doing currently, and what do you think you should be doing about adolescent health? And that led us to understand that there was very little happening at the time. But look, I want to pay tribute to Gallagher. I mean, Gallagher was on the way to being a cardiologist. He set up his clinic in Boston after his experience as a school doctor, and he published, edited and put together this book in 1960. So that was the very first textbook of adolescent medicine. This edition, by the way, the third edition, he inscribed to Murray, and then Murray has passed it on to me some years later. And I'm looking for somebody to give that to. But the body of information that was coming together in those sorts of publications were important. Coming back to the quality of, the clinical approach that we're thinking needs to be taught. I learnt from Murray that, a pace and an ease and a sort of a focus on a young person as a person were the qualities that came through to me in our conversations initially. And I must pay tribute to the HEADS exam, which was originally penned as a mnemonic by Henry Berman. The late Henry Berman did that. It was picked up in Richard Mackenzie's unit and published as a document that has influenced teaching. But I think this whole idea of asking a young person about what's happening in their life at school and at home and with their friends, that hadn't been part of medical thinking prior to Gallagher's example and these later developments. And that's become the bedrock, really, of psychosocial history taking for young people. Developments in Australia, I think, really got underway late 80s and 90s with the Centre for Adolescent Health in Melbourne setting up its training programs and its research programs. And then our Centre for the Advancement of Adolescent Health in Sydney also focused on creating resources, and the GP Resource Kit, which, as you know, is a very comprehensive catalogue of resources and approaches and materials. I think that's been really important. And I would also underline Murray's comment or implication that having people in primary health care, not just in medical disciplines, but other allied health disciplines, that's an incredibly important way of advancing the field and making the health of young people better.
No, thank you. And I think my understanding, my looking around at where we're at the moment in Australia is that we have pretty good resources available now for general practice. And I want to just quickly take a nod to Lena Sanchi, who's really led the development of
Absolutely.
GP training. David, I think you were involved in some way in physician training, subspecialising in adolescent medicine. Certainly you ran the department which fostered and supervised those registrars. But perhaps there are other disciplines, including even nursing, where there could be there's a lot to be done, I think. And I'm currently working with some colleagues in my clinical service who are starting to develop, with the New South Wales Ministry of Health, some competency frameworks around youth health nursing, which is very exciting. I think there's been a little bit of mumbling over the years of the nursing workforce becoming subspecialised. We have many wonderful youth health nurses, but there's no formal training in adolescent health for them. So, all right, look, I'd like to.
Can I say something?
Yes, please. Yes.
Just that the way you can test this is, as I did with people doing problem-based learning in medical school, postulating an adolescent patient that they've studied about. So, talk to this boy. I'll be him. I'll talk to you. Talk to me. They made total clowns of themselves. Yeah. They did not know how to have an ordinary conversation, let alone one of a clinical kind, which was still not threatening, which was positive, which was encouraging, all of those things. And that applies across any discipline you can think of. So it's a useful tool to have to try and encourage people to scratch their heads and say, well, what should I be doing here? Because it quite astonished me how stupid some of them could be.
Yeah. Yes, that's right. Yes, no, look, I think I feel that, certainly one of your legacies, Murray and David, is most general practice trainees that I train each year who have just come out of their hospital-based post-medical school years. They all have a really solid grounding in HEDS assessments. I think medical schools are really good at teaching that now. So, it really has led to it being a normal part of the curriculum. The same is true in the general practice curriculum, the physician training, paediatric curriculum. So I think you don't undersell the impact you've had on huge workforce in this country. Yeah. I'd like to sort of start to close off the interview with going back to some personal reflections from each of you, and really to pay tribute to each of you and the role you've played in advancing the field of adolescent health in Australia. But you've both written, and I've loved rereading some of the things you've both written in preparation for this interview. You've written about the essential qualities of an adolescent's health provider as being qualities like creativity, humour and empathy. We're not taught these things in medical school. Could you just reflect on really why and how these particular qualities, or any others that you'd like to name, why are they important, and can they actually be taught? How do we teach them to our health students? Murray, would you like to start?
Well, I think it's really saying something about what you mentioned before about doctors and their sort of routine kind of methods dating back to the 19th century, a little unwelcoming in the usual setup which adolescents might find them, or have been. This has changed a lot, as you just said. But then you can think of ways in how they might change them. And I think you look to all sorts of other kinds of things. I use, for example, creativity. If a young person was having trouble talking, I said, look, would you like to draw me a picture? I've got to go outside for a few minutes, but I'll be right back. And you would be astonished. Well, you wouldn't. But a lot of people would be astonished at the kind of things which produced then a useful conversation. We didn't talk about the picture, but it opened up a door which that part of the mind is often kept closed. And one boy played his flute for me. Every time he came to see me, he used to play his flute for a quarter of an hour. It was much better than anything we could talk about. And those were the sort of positive, useful things. I made several films, as a matter of fact, which were expressions of that person's particular, his particular vision of himself, I suppose. In other words, it was a way of coming to see with what you are. And I like the image of being a mirror. Anselm Strauss, a very well-known medical sociologist, you're probably aware, used that image that a young person sometimes for the first time uses you as a kind of mirror. The way you reflect what you see is maybe the first time he's ever had that. You know, he's had a punitive father or a doting mother or an auntie who sort of showers him with money, all sorts of things. But who is he really? What's he like? And by the time you're about 15, anywhere from then on, it's starting to be important. So I think of that image now, and I'm trying to look at this whole issue, and it comes right down to that, you know, how you respond, your response, your acceptance, and your mirroring of that, all the positive things, that is, which you can find in this young person.
Murray, I'm going to use this segment of this video to teach medical students, if that's all right with you. You give me permission. I think that was just such a beautiful way of describing different ways that as health professionals providing clinical care to adolescents, we can just think outside the box about how we might engage them in some dialogue, in some conversation.
The first thing you do is throw away your big desk.
Yes.
Do not hide behind a big desk. It's the most off-putting thing it could possibly be for any patient, but particularly for young people.
Yes. David, what about you? I mean, you almost pursued music as a career. You're innately creative and artistic, and I know that about you as a friend and sure. And mentee. But yes, could you describe these essential qualities of an adolescent health professional and how to engage with young people and why you think they're important?
Well, they're important, and I discovered that in conversations with Murray 60 years ago. But young people are shy and naturally reluctant to share personal information. And I think it's our job to put them at ease, and that's actually the essential thing. So quiet conversation achieves more than an interrogation or a clock watching, rigid or timed approach. And I think this is actually the nature of modelling. And most of the people who have entered into adolescent medicine have been inspired by somebody who was kind in a clinical encounter, or watching somebody who was taking an interest beyond the presenting problem. And I think there's something special about our field. We're interested in what lies behind coming to have that conversation. I do want to mention Henry Berman again, because the book he wrote in which he interviewed the proteges of the pioneers, very few of the original pioneers, other than you, Murray, are still alive. But I think I would again say that gentle psychosocial history taking and respect for the confidentiality and privacy of young people are the key traits. I still have an opportunity to talk with medical students in their first year at one of our universities, and they come alive to the idea that there's kindness and mindfulness sitting behind a clinical encounter. And I would also say that practicing personal mindfulness, this is now being encouraged in healthcare. It's good for the clinician himself because you become more grounded and more compassionate, I think, as well, but also to encourage young people to deal with their stress and to manage their emotions. This is part of a conversation, whatever the presenting problem.
That's really useful as well, I think, and certainly in my work with young people, and I work with a multidisciplinary team, we are certainly all using mindfulness principles with the care we provide. But I think perhaps it is something that could be more formalised, and we need to bring that into some of the training that we do as well. So thank you. Look, I'm going to close this interview with a final question, which is more than a question, really. And I know, having just listened to you both, you're both exceedingly modest, and you're not probably going to answer this question adequately for me, but I'm reflecting on the fact that you've both been awarded Orders of Australia, and for our international audience, these are the highest honours of recognition of people in our country. It takes extraordinary people with extraordinary commitment and devotion whether it's in their professional lives or personal lives or both, to receive these awards. So I'd like each of you to tell us, please, about the importance of that recognition at a national level, not just for you personally, but actually for the field. I mean, you were both awarded these officers of the Order of Australia because of your service to medicine and adolescent health. And that has to say something about certainly your personal legacies, but But what are your hopes that something like that would lead to for the future of adolescent health in the 21st century? Who'd like to go first? Murray.
It puts it on the map. That's really what to say about. And I think there have been people who have observed that. I found it rather overwhelming. I didn't think that I had done as much as that. Did anyone even bother to talk about it, let alone that? So I think David might feel the same. But it's hard to measure it otherwise, because unless you're in touch with, the medical training field, you don't really know what's going on at that level. And in medical practice, people sort of separate out in their different directions, and you don't really hear again what they're doing. But you've pointed out how they did take home a message, and I think that influences it.
Yeah. Thanks, Murray. And David, what about you?
Look, I agree. We've talked about this. There's a timeliness about, the honours and the significance of a field that's come to the point where it wants to be grateful for, the work that's gone into it. Nothing happens in a vacuum. Everything happens as a result of people joining together to create something. It's Margaret Mead's famous remark, group of concerned citizens, and so on. So, it's not false modesty to say that we were in the right place at the right time, be recognised for decades of work. It didn't just happen overnight. But as you say, it does indicate that there's an awareness of the value and importance of a body of work. Murray and I have been very fortunate, not only in our friendship over 6 decades, but to have watched, nurtured in the early stages, definitely, but then watching the next generations that come with you and beyond, carrying on the legacy of the work. And it's lovely that you can look back and say, well, thank you for getting things started, but we are now in a position to say thank you for carrying things on,
yes,
and taking them to the next level.
Quite unimaginable as far as I'm concerned. I've said it before, but it is really astonishing to see where IAAH has gone in this period, since I've no longer been involved with it, but I of course get the newsletter and I know what's happening. And it really is amazing.
Yeah, no, it really is. And I feel so incredibly privileged to be part of this international group now. I sit there quietly in meetings not knowing what to say really, but going to Chicago last week and meeting everybody face to face on the council was extraordinary. Look,
I think they're lucky to have you there.
Thanks, David. Thank you. Look, I think that's probably all the questions I want to ask. If there's anything else you'd like to say, please do. But I started this interview by saying I felt rather overwhelmed to be in your company. And I have to say I'm finishing this interview feeling even more overwhelmed. And I know that, 45 minutes of chatting to you both in no way does justice to the incredible decades of work you've both done and continue to do. I mean, you're both still incredibly inspiring and have a lot of wisdom to share. And I thank you on behalf of the international community for that and for being willing to let us share this interview with the whole world. It will be available on the website for IAAH at some point and, for all the world to see. So thank you again.
Melissa, I hope this is not too cheeky, but I just want to show this photograph. It's Murray Williams with David Bennett and his team, and that's Bill Daniel, who was our guest lecturer in Sydney. And that's really how it started for me in Australia, with that wonderful group of people.
Yes.
And the mentorship, friendship and support of two wonderful men who were just a little bit older than me.
Wonderful. Thanks, David. Thank you again, Murray.